crowns a tooth. The primary cause of gingivitis is a lack of oral hygiene. A biofilm of bacteria called dental plaque starts to accumulate on teeth, particularly at the gum line. The bacteria in the biofilm releases toxins. The body reacts to the toxins by causing an inflammation of the gums. The gums bleed easily when touched and can emit a foul odor. To help prevent gingivitis, start by brushing at least twice daily to remove any plaque buildup. Daily flossing will also help remove any bacteria in between the teeth. Along with scheduled visits to your dentist, you can help prevent gingivitis from becoming a severe oral health issue.